some cases can turn into an aesthetic nightmare when you lose your interproximal tissue around an implant. And obviously we all see where the implant is, the upper left central incisor. And we see the problem with the tissue level. We see the recession on the implant that happened throughout the treatment. We see the problems with the contour. And some of us, including myself, can't sleep at night because of that. It turns into a nightmare. And apparently it's happening a lot. It's happening, maybe close to 50% of all cases, which is a huge number. Now, our patients are not expecting 50% success. They're expecting close to 100. And I hope this webinar is going to help you. So doing surgery in the aesthetic zone is not for every dentist. It's not for everybody. And that's okay, because it takes a certain mindset. It takes a certain preparation. And it's not for everybody. But I assume everybody on this presentation, on this webinar, is interested in doing surgery in the aesthetic zone, is interested in getting involved, is interested in helping their patients and building their practices. And this is going to be very helpful. You're going to need 4 things to be able to do surgery in the aesthetic zone, to be involved with surgery. You need 4 things. Okay, so what do you need? You definitely need knowledge. You need the training. That's very, very important. That's part of what we're doing tonight, this evening. Some of you guys, it's in the morning. So any time of the day, you're learning, you're gaining knowledge, you're becoming smarter. And you also need to train. You need to learn how to do this, whether it's in a residency program or you need to take some long-term courses, a mini residency. But it's not enough to have knowledge and training. You really need to practice. You need to put everything to the test. And you need to acquire some surgical skills. Also, extremely important. You need to get your hands wet and you need to know how to do. You need to experience what it feels like, how the tissues feel like, what it feels like to reflect flaps and make incisions and suture. You need to build up your surgical skills. And as you do it, you need to make mistakes, okay? You need to experience some complications. You need to have the experience of handling complications, sometimes successfully, sometimes not. But you need to get these things under your belt. You can't practice and train and take courses and lectures and webinars and online courses and watch YouTube all day long without doing, because you will not acquire surgical skills. And even if you start performing surgery, if you don't do enough of it, you will not get to experiencing complications and making mistakes. I made my fair amount of mistakes in my career and still making them on pretty regular basis. And what's important is to learn from your mistakes. So these are the 3 most important things. But I said 4. Now 4 things. Actually, the 4th thing that is probably the most important when you want to transition into surgery in the aesthetic zone is really having the proper mindset. And what do I mean by a mindset? Mindset is basically a certain attitude or a disposition. Have the right mindset, the right intention to operate in the aesthetic zone. It's not the same. And for the ones of you that have some experience, it's not the same replacing a lower molar, like the money tooth, and replacing a central incisor. It's a totally different ballgame. It's not so much about the knowledge and the training and the skills. It's more about the mindset. And what is the mindset to perform aesthetic surgery consist of? The mindset has to do with your confidence. Okay, you need to not just be confident internally, you need to project confidence to your patients and your team, and not fake. It has to be real, unfortunately. Okay, and that's very important for your mindset. Number 2, you have to have a big picture view, a big picture attitude, not to be dogmatic or narrow-minded. or be a one-track mind, just extracting teeth, placing implants. You need to look at the big picture, look at the adjacent teeth, understand the patient, know about the different protocols, but knowing when to use what, being flexible based on the situations and the circumstances during the surgery. And very important, being a very good communicator, having good communication skills with your patient, being able to convey the challenges and how difficult it is and what are the things that we are working against when we replace teeth in the aesthetic zone, and creating a great rapport with your patient, and also in a way lowering their expectations, because what happens, patients are coming in to replace a central incisor and they are thinking this is just like having a new crown and we're just replacing a tooth. And the reality, no, success is not always guaranteed, and we need to have very good communication skills to talk to our patients. Now, I'm not going to spend that much time on communication in this webinar, but I'm going to talk about it in more future training. So you need to have a good mindset to perform aesthetic surgery. Now, the bigger question is, how do you get into the mindset? Okay, how do you get confidence and big picture view and have all these communication skills to be successful? How do you get that? I definitely did not have any confidence when I started. And basically what I wanted to show you, and Dr. Dana Levy from Toronto, I don't know if you were present, you were my instructor at the time. This was my first incisor extraction back at the University of Toronto. We're talking, I don't know, 16 years ago, a long time ago, 17 years ago. And even then I was obsessed with taking photographs. Of course, the camera was not the same, and we have now better cameras with better resolution. But I think you can all see that there's a problem with tooth number 8 or number 11 if you're with the Canadian numbering system, the upper right central incisor. The lateral and the central sustained some type of trauma, were intruded, and the central incisor started to resorb. So it's definitely a disaster. So if you look at it very carefully, and this is my first central incisor extraction, I was, I was very nervous. I'll be honest. So what are we looking at? We're looking at a tooth that has a very long, skinny root and is endodontically treated. Okay, what does it mean? That this tooth can break very easily. It's weak from the outside. It's weakened from the inside through the root canal process. It's severely resorbed. And pretty much a disaster. Okay, so disasters will always there and will always be there. And these patients come into your practice almost every month or every week. Definitely into mine. So the first thing that I wanted you to consider when you're extracting a tooth, and we talked about it in the Money Tooth book when I talk about the lower molar extraction, you'd like to have some type of plan, a course of action, some type of steps, and maybe some alternatives on how to extract this tooth. And one of the things that I always recommend with resorbed teeth or teeth in general, try to predict the extraction. Where is it going to break? Okay, so I think it's fair to assume it's going to break mostly at the coronal aspect. Maybe some fragments will come out, and then it's going to be pretty hard to remove the root. Now, I think this extraction, and again, if Dr. Levy from Toronto was present, I think it took me like an hour and a half, and I took it very, very, very slowly. And very surprisingly, I got lucky. I got the tooth in one piece, and it's pure luck for my first extraction. And it's not because I'm that good. It's just pure, sheer luck. It came out, and I did not have the mindset of doing aesthetic surgery. All I was thinking about, there's a bad tooth that needs to come out. I have a socket. I was what I now call a one-track mind. Take the tooth out, place the implant, don't look at the adjacent teeth. And if you're looking carefully, I may have done a pretty nice papilla sparing incision and flap. But if you look at the level of the implant, it's probably about 8-9 millimeters from the adjacent CJ. We know it's pretty deep, and the angle was not ideal. And I didn't have the whole view of this case. So I didn't have the big picture view. Now it took a few years through more knowledge, training, practicing, doing a lot of this work, getting the clinical experience and the clinical skills, the surgical skills, and also making a lot of mistakes over the years, and understanding what these mistakes were, correcting them, until I got to a point that I developed more confidence. Okay, so once I developed the confidence in doing more, that can change, and that's going to change for you as well. When you develop your confidence, true confidence from the inside, and that does not mean that you'll be always successful and that you can guarantee success, not at all. There are a lot of things that don't depend on us. But if you are confident, if you have a big picture view, and you understand the whole picture, and you see the forest for the trees, you see the whole book and the forest from the outside, you are not dogmatic, you know that there are alternatives, you're not married to one treatment option, and you have very good communication skills with your patients, you will have developed the mindset to do aesthetic surgery. And that's what's happened to me, and that's what's going to happen to you.